Hi, my name is Ashwini. I'm a podiatrist from the Foot Care Clinic in Keysborough, and today I want to speak to you about diabetic foot assessments and why it's important to check your foot as a diabetic. So there are two different things when it comes to diabetes and your feet. The first thing is the blood flow, and the second thing is the sensations of your foot. So first looking at the blood flow down to your foot, your feet being the furthest away from the trunk of your body, the blood flow down to your foot could greatly be affected with uncontrolled diabetes. So it's very important to know that you need a good blood flow to heal wounds. So for example, if you cut yourself and that created a little wound on your foot, um, without a good blood flow, the chance is that it might not heal properly, which could lead into complications such as infections. So it's very, very important that you have a good blood flow down to your foot. So there are several ways to test for what your blood flow is like. First thing is that we palpate your pulses and we feel how strong your pulses are. And then we can do a Doppler ultrasound, which is a non-invasive method in a form of ultrasound, which emits high frequency sound waves. So we can study the pulses and the blood that is flowing through like your small blood vessels of your feet. The next thing we look at is your sensation, your fine sensation. So um, having a good sensation intact, it's very important. Um, so the first thing we could do is a monofilament testing. So that we use a soft nylon fiber, which is like called a monofilament, where we brush it over the skin um, of your feet to test your sensitivity. And we also use instrument called a tuning fork, where we check vibration test, where we check the vibration sensation of your feet. Um, having a this pretty much gives us an indication of how much of your sensation is intact. And also during the consultation, it could also include a thorough gait assessment where we watch you walk and see if we notice any type of abnormality or any type of issues that we can address during the consultation. We could also do a footwear assessment where we look at your shoes and see if it's supportive enough and just your general skin and nail health as well. It is also important that you come prepared for the consultation. What I mean by that is that you need to know your blood glucose levels and come prepared. We will definitely be asking you some questions and ask you questions about how you manage your blood glucose levels and what type of medications you're taking, and have a conversation with you about that. So I think that gives you a brief outline of what a diabetic assessment is and what it entails. Usually we like a diabetic assessment to be done annually. However, it is up to the podiatrist to decide if you'll need closer appointments to check your diabetes foot health. So I hope this was informative, and if you are a diabetic, I hope you come to our clinic to understand how your diabetes is affecting your foot. I hope to see you soon.